A bone disease that occurs when the body loses too much bone, makes too little bone, or both. As a result, bones become weak and may break from a fall or, in serious cases, from sneezing or minor bumps. This skeletal disease is known as osteoporosis. About 54 million Americans have osteoporosis. The average life expectancy of osteoporosis patients is in excess of 15 years in women younger than 75 years and in men younger than 60 years. Causes of the Causes of the disease are a lifelong lack of calcium, which plays a role into the development of osteoporosis. Low calcium intake contributes to diminished bone density, early bone loss, and increased risk of fractures. Eating disorders severely restricting food intake and being underweight weakens bones in both men and women. Many people have no symptoms until they have a bone fracture, though going off a bone fracture, you would require a medical diagnosis to really see what the symptoms are for osteoporosis, as it varies by person. A diagnosis for the disease can be given through bone density, which is measured through a machine that uses low levels of x-rays to determine the proportion of mineral in your bones. During the painless test, you lie on a padded table as a scanner passes over your body. In most cases, only a few bones are checked, usually in the hip and spine. Treatments for the disease can vary, as treatment recommendations are often based on an estimate of your risk of breaking a bone in the next 10 years using information such as the bone density test. If your risk isn't high, treatment might not include medication and might focus instead on modifying risk factors for bone loss and falls.